a senior HR consultant with our firm. While I'm going to get us started, and I'll come back at the end to talk for a bit, Karen is going to be doing the presenting of the information today. And I'll tell you a bit more about Karen in just a minute. But first, what a crazy few weeks it's been. The world hit with and reacting to a major pandemic. We've seen it spread throughout the United States, sometimes predictably, sometimes not so predictably. We've seen some businesses close, some drastically change their operations. We've seen workers furloughed, laid off, and terminated. And we've seen other workers who are working from home like never before. We've also seen government respond at the federal, state, and local levels. We've seen new government programs intended to help employees stay working and to help employers stay in business. And we've seen these issues hit closer and closer to home. And while some of you may not have dealt with an employee infected with COVID-19, or you may not have had to respond to an employee who has a family member either infected or exposed, as time goes on, you're more and more likely to face those issues. Before I turn things over to Karen, let me tell you just a bit about her. Karen has about 25 years of HR experience, including time with Citibank, with Citicorp in Kansas City. After moving to Sioux Falls, Karen spent time managing HR with one of the larger nonprofit agencies in the area. Since joining Alternative HRD about 9 years ago, Karen has worked with scores of clients, both large and small, as they compete for talent, as they comply with all the laws and regulations out there, and as they work to create an environment and culture where people and organizations can excel. I'm very pleased to introduce Karen DeLange. Karen, go ahead and take over if you would.
So thanks, Dan, and thank you to all of you for attending this afternoon. Like Dan said, my name is Karen DeLange, and I will be leading this webinar today. And I have to say there are some positives that have come out of this pandemic, other than positive diagnosis. And one of them is that we had talked about doing webinars as a way to supplement our face-to-face seminars for a long time, and kind of took this and watching other people try it to say, okay, let's see how this goes. So the reason I say that is partly to apologize, because this is the second time that we have done this. So if there's any technical issues, we are not videographers. We don't have a huge IT staff. Okay, we have 0 IT staff. So if there are issues along the way, apologies up front. I am recording this, and I am going to send out the slides probably tomorrow, so that if you have to miss some of it, or if there's a lot of information on here that you can't read, just know that you're going to be getting the slides after that. Everybody, including us, has been reading the resources that are out there. We've been attending other people's webinars. We've been listening to the press releases, trying to learn how to respond, how to prepare our responses to this new COVID-19. I feel in some ways I've become a pandemic specialist, or maybe a doctor in something or other. But we at Alternative HRD have the privilege of working with multiple companies. So we've researched a lot of different kinds of scenarios that have happened, and we thought we would just take this opportunity to share some of that information. I'm just going to remind you up front, obviously we are not attorneys, but we have compiled some of the best practices from a number of different sources, and just tried to weed through all of this to be able to compile, hopefully, a step-by-step action plan that you can put into place very practically in your own workplace. So there are times that we do refer to external counsel, but whenever possible, we do try to help our customers with what they need. So today we're going to talk about a few things. First, again, I'm not an attorney. We're going to do some legal things, talk about a timeline, some discussions, some communications that you can take, and then kind of what are your next steps. So I'm going to try to go through this fairly quickly. And first of all, as far as the legal part of it, employers could be legally liable for both the employees and for even non-employees that are infected at the workplace. But at the same time, people with chronic diseases or COVID-19, something like that, are also protected against discrimination. So it's very important that you have a plan in place that you consider both the legal protections of the employee and also of others that might be there. Recognize a risk and just kind of reduce your liability that goes forward with it. There are things that you need to put in place as soon as you have response, that you have learned that an employee has positive COVID-19. And so we're going to talk about what some of those are. There are a lot of employment laws that should be considered, and some of these include the ones on this list. Just because it's a pandemic doesn't mean that all the other employment laws are just out the window. When we make decisions as employers, we need to be mindful of the other things the other protections that are already in place. So the ADA, which is the reasonable accommodation, the rehabilitation, which talks about the privacy of medical examination and inquiries and things that we can and can't ask. Of course, there's OSHA. That's where you get safety measures and recording of illnesses that happen in the workplace. Title VII, age discrimination, genetic information, and then HIPAA. So all of those are things that you just want to keep in mind. They may or may not apply to every situation that comes up. The EEOC has said that some of it, while those laws continue to apply, at the same time, they don't prevent employers from following the CDC guidelines, which is one of those confusing messages that we have learned along the way. That yes, you can do this, but no, you can't do that same thing, where they just say the exact opposite. But it is one of those things. So they said, yes, you need to follow all of those requirements, but it is okay to ask if they're experiencing symptoms of COVID-19. And right now, those symptoms are fever, chills, cough, shortness of breath, sore throat. Now they expand the list, change it, things like that, but that's what it currently is as of about a day and a half ago. That's what it was. So you can ask if they're experiencing symptoms of those. And one of the requirements of the ADA is that any information that you keep about somebody's medical records have to be kept confidential. So anything that you do have record of, make sure you're keeping in a confidential file, not their regular personnel file. You already all know, keep medical. There's some things that you have to keep out of the personnel file, and one of those is the medical. So I'm going to talk about what to do if you receive a notice that employee has tested positive. But before I do that, I want to just talk a little bit about some of the times when it's not an employee that's tested positive, because more and more the questions that we're getting have to do with this. And so people get a little confused about what they should and shouldn't do. So for example, an employee tells you that their spouse has had close contact with someone who tested positive. Another situation was a delivery driver entered a business that had a positive diagnosis. Or your employee, they shopped at an area store. They heard on the news that while they were there that day, on that hour, there was someone in that business that had positive diagnosis. In fact, it was one of the clerks. Now, they're not sure if it's a clerk that they used or not, but they were there. So what are you supposed to do as an employer? Or maybe your employee visits a friend or a family member. They're not experiencing symptoms. The family member's not experiencing symptoms. The person may be out of state, or they may just be across town. But what are you supposed to do with it? And so what happens is we don't actually always know, and so sometimes we overreact. The South Dakota Department of Health has put together a really good slide, and I put the link directly on this slide, this infographic, and there's more information. I just blew it up so that you got the important information on here. Highly, highly recommend that you go to this slide, print this infographic. I have it in my fridge at home. Because to be honest, if stuff comes up, you're like, oh, what should I do? What should I do? And the first thing that happens is you kind of want to panic. But let's just go back to the example of the employee whose spouse had positive contact, somebody who had close contact with somebody who did test positive. So now you're talking about the employee. So the employee has been in contact with someone who might have been exposed or who has been in close contact with someone else. So with this one, it might have been exposed. They've been tested. Now, the spouse has been exposed. The spouse is not experiencing symptoms yet. So it tells us to self-monitor and practice social distancing. It does not say that your employer should send you home for 14 days. Now, if the spouse then tests positive, then it's probably appropriate to self-quarantine and self-monitor, and that's where you would probably send the person home for 14 days. So you kind of want to just walk through and make sure that you're doing the right thing. You want to be cautious, you want to be all of that, but before you panic, just stop and say, okay, so, you know, my employee went to out of state to go visit grandma. No one is sick, no one nothing. They're wearing the masks, they're taking protection. Should we or shouldn't we? Which one should we do? Where should we go? Well, this hopefully will help you decide. Now, the slide itself has more information about what self-quarantine means, what self-monitor, what social distancing means. So I just recommend that you do that. I just wanted to talk about that before we go into the rest of it, because what I really wanted to talk about today was what you should do when an employee has tested positive. So your employee tested positive or has gone in for testing and they're waiting for their results is the other part of it. So what do you do? I'm going to go through a timeline about what happens and what steps you should take to react for it. And the first thing to do is don't panic. You know, remain composed. When you talk to them, demonstrate some empathy. At the same time, you want to be confident. You want to show leadership. You want to take action, but you want to be appropriate about it. Communicate in the right ways. And that just, it calms everyone's nerves. And if you have a plan in place prior to this happening, it will also help you not to panic. So that's why we're going through this today, just to help you kind of go, okay, let me think about this rationally and not from fear-based, because when something happens, we go into that tunnel vision and we forget everything that we already knew. So first thing is don't panic. The second thing is if the employee is currently in your facility, figure out how you're going to get them to leave. Now they do say, again, this is some of those opposite things. So if they're on site, they should leave immediately. Oh, but they should be isolated immediately in an enclosed space such as a conference room. But so again, you want to take them out of the general population. You want to get them out of the building just as quickly as possible, but at the same time, protecting their dignity, protecting their privacy, and then protecting your other employees, which is avoid exposure to others. So that's the first thing you do. Let them know that they should go home and that someone will be calling them. And of course, tell them if they haven't already that they need to contact their medical professional. So after they've left the building, the next thing that should happen is you should have a meeting of your response team. So within the first hour or two, you want to pull together the people that are closely involved in this. So the employee's manager, you know, key executives on your team, HR, whoever it is. Now again, the social distancing meeting, maybe that's a conference call, whatever it is, but have a gathering of great minds together. And the following slides are going to be what should be on the agenda for that meeting, things that you're going to want to discuss and get figured out. So first thing is figure out who's going to be communicating with the ill employee. They need to follow up with them, you know, soon, and I'll give you some things that they should talk to them about. But also along the way, while they're ill, while they're getting treatment, while they're waiting maybe for their final results, you know, when they come back. So who's going to be communicating? Assign that to somebody. The second thing you want to do is to figure out the exposure to other people. So talk about who has had contact with the ill employee during the time the employee had symptoms and 2 days prior to the symptoms appearing. And just kind of brainstorm together, pull together, you know, where do they work? Who do they work with? What kind of meetings do you know about? You know, do they go outside the building? Just kind of start developing a list of who they had exposure to. And then from that list, you're going to want to identify close contacts. Now, close contacts is one of those, again, where we get conflicting information about what is a close contact. Close contact is typically someone who has been within 6 feet of an exposed person or an ill person for a prolonged period of time, which is anywhere from 5 minutes to 30 minutes. So I believe the latest that I saw on the CDC for their contact tracers, they're giving them a guidance of for 15 minutes or longer. So obviously if someone is sneezing or coughing, that increases your risk for exposure, so that changes everything. The South Dakota CDC said prolonged exposure is anything 6 feet or closer for 5 minutes or longer. So again, they're kind of all over the place as they learn more and more about this virus, but identify who within your building are the close contacts. Those first, then the next thing on your agenda would be to plan the communication. So is there going to be a different message for those who are close contacts and those who are in the general employee population? The close contacts, you want to have conversations with them quite immediate, and they also should be sent home, and at that point they self-monitor, practice social distancing, and possibly self-quarantine because they've been exposed for prolonged periods of time for somebody that's tested positive. So again, you kind of go back to that CDC infographic on what to do with that. So you'll want to have that conversation with them fairly soon. For the general population, those who you've deemed as not really as great of a risk, but they've been in some sort of contact, there's a different message that you want to get to all of them. Later on in the slides, I'll give you some sample of things that you're going to want to say to them, but basically you want to make sure that they all receive it. You want to have it as, style it as a letter when you do this communication to them. You don't want to have it as a warning or a notice. You don't want to heighten their alarm. You want to calm them down, which is why, again, you kind of want to have a tone either from HR or maybe the head of the company. In it, there's some things that you do need to make sure that you're doing. First of all, maintain the confidentiality of the ill employee. Don't tell them who it is. But what you might say is that someone's been diagnosed. If your company has departments, you could say, in a certain department, unless it's a small company, then you want to leave that out or they're going to kind of figure it out. You'll say that the people that have had close contact have been communicated with and they're being sent home. Talk a little bit about everybody else should have good hygiene, social distancing. You're going to disinfect the work exposed area. All the things that you're kind of doing. Encourage them to stay home if they feel sick, that kind of thing. But you want to do that fairly soon because the rumor mill, it doesn't happen much. It doesn't take long. So you want to have that planned out, and then you're going to want to distribute it fairly soon. So also in that first meeting, with the agenda on your item should be talk about what the compensation plan is for the employees to be sent home. Now, the ones that are sick, the one that has the diagnosis, probably falls under the FFCRA and to get paid under the emergency paid sick leave. I say probably because, again, they only have 80 hours max. If they've used it, they don't get to use it again. The other employees who have just been exposed that are self-quarantined, they probably don't fall under that FFCRA. They may, but they probably don't. So how are you going to pay them? So you want to talk about that. You want to talk about, have somebody in charge of making sure that the organization is actively mitigating exposure. And by that, I mean, have you got your hand sanitizer out? Are people using their face masks? Are you got your signs up? Are you practicing social distancing? Are you holding your meetings, remotely if possibly, or in large rooms or whatever it is? And then the last thing for that agenda is to identify a point person and who is maybe in charge of cleaning or disinfecting the work area. So who is going to be contacting maybe the outside source to be able to make sure it's clean. So identify somebody for that. So within the first couple of hours following that meeting, now this may be a meeting of the same people, or it may be a separate meeting, or it may be just the owner themselves that figures this next part out. So what's the impact of workplace closure? If you're a small company and basically everyone has had close contact and you end up having to close, or there's a number of people and you end up having to close, what's going to happen because of that? Are there people that can work remotely? Is that a thing you can do? The plan, you put into place also the plan to talk to those who were in close contact. That needs to happen in the first couple of hours. The person who is sick and sent home, that needs to happen in the first couple of hours. The remaining workforce, again, make sure that happens in the next couple of hours. If there's messages with the state and local health officials, now I talked to the South Dakota Department of Health, and typically they communicate with the person who is sick. On occasion, they may contact the company, and on occasion, if you want, you can also contact them. But they do have regular communication with the person who is sick. In fact, daily, because they're monitoring their symptoms and that kind of thing. They'll get a written notice that they have been diagnosed, and they also get a written notice of release. So just kind of be aware of that, that if you have any questions or anything, you can contact them. When I asked for the number, they just said it's the number that's on the website. So it's just a regular, there's an 800 number you can call. And they answered. I wasn't on hold. They answered right away. You might need to prepare a statement for the media in case, again, depends on what your situation is, maybe for your customers, if you have vendors, if you have people that are out and about that maybe they infected somebody that's, maybe it was your delivery driver and he was out and about and you need to talk to those people. So kind of figure out what you're going to do for that. And then confirm any arrangements if you have to clean and disinfect your facility, make sure that that's happening. Some of the stuff you can have figured out ahead of time. So again, the communication with the workforce, no reason why you can't draft something ahead of time. You know, making arrangements with a cleaning and disinfecting facility, well, that might be hard, but you could look them up to find out what you're going to do. So all of those, some of those things you can figure out ahead of time. Okay, within the first 24 to 48 hours, that's when you do your cleaning. Now, again, those first two bullet points are things that are opposite of each other. So the first thing is you immediately close off the area. And then number two is, but you open up all outside doors and windows. But of course, what they mean is, so it's, let's just say it's your accounting department. And I'm getting a text in my phone. I just make sure that wasn't one of you. So you'll want, if it's like, say, in the accounting department in an office, you want to close off that office. Obviously, everyone inside that office would have been a close contact. And so you're going to want to send them home, but then maybe open up the outside doors and windows if you can. They suggest waiting at least 24 hours before you begin cleaning and disinfecting. And the reason for that is because the virus starts to die off. So you'll have less chance for exposure. Now, they do recommend, again, that you hire not just your regular cleaning company that may come in, or they don't recommend doing it yourself, but instead recommend hiring someone who knows what they're doing for cleaning. However, if you do it yourself, make sure you're wearing disposable gloves and gowns. You should clean first and then use a disinfectant to make sure that first you get the dirt off and the dust off, and then use a disinfectant to clean the surface. And you think about everything: offices, bathrooms, common areas, you know, the lunchroom, electronic equipment, tablets, touchscreens, keyboards, remote controls, ATM, whatever you have there that they may have used, that's what needs to be cleaned. If it's been more than 7 days, they said, you know, the additional cleaning and disinfection isn't necessary. Just do your routine cleaning and disinfecting. And then within 2 days, you'll want to handle all of the compliance matters, the things that you talked about before. So it may be, you know, if they are eligible for some of the government leave programs, you want to make sure the tracking is done, the notifications are done. Again, that Emergency Paid Sick Leave Act, they get to choose that. So you do need to notify them that they're eligible, but they get to opt in. They don't have to, you don't have to force them to take that. And then, of course, within the next couple of days, you're going to address any impact on your customers. So I'm going to talk about, so the employee, you've sent them home, and now you need to talk to them on the phone. And so what kinds of things do you want to talk about? And these are things that you probably already know, but it's sometimes a good idea to just have an outline. Again, that tunnel vision comes in and you kind of forget, and you want to appear professional and come across as if you know what you're talking about and that you're not panicked. You want to show leadership in a time of crisis. So again, have the point person call them and first show recognition and empathy. Thank you for letting us know about your diagnosis. We hope you and your family take whatever steps are necessary. Let us know if we can help. Given your diagnosis, you know, here's what we want you to do. That's kind of how you start out the conversation. I typed this part out. I know there's a lot of words on the screen, but I typed it out so that you kind of knew where to start. So that's just a sample. But then you're going to want to talk about a number of issues when you're on the phone with them. So, You'll want to talk to them about personal issues. Do they have property that they left behind that they want to have for the next 2 weeks that they didn't think about, but that they actually need? You know, you may need to get that to them and have it sent to them. Is there anything else you can do to be helpful? They may have questions about their healthcare coverage, about their leave, or about their pay, that kind of thing. So just talk to them about that. Help them, you know, feel calm about that. Then talk about work issues. You know, what do they have for projects that they're doing or meetings that they have scheduled, or, you know, maybe they're able to work remotely, and what do they need to be able to do that? Because, you know, they may not actually be feeling sick. So, you know, kind of what does the next couple of weeks look like? Are there other employees that could do some of their work that are maybe already cross-trained? And then talk to them a little bit about the contact with other people, especially any unusual contact that they may have had, many off-site meetings, vendors, things that you maybe wouldn't have thought of. Now, in some companies, especially smaller companies, people may know who they are, and people are friends with each other at work. I get that. That's perfectly fine. You don't want the message coming from you, who they are, unless the employee gives you permission. If they say, yes, please tell them, you know, we're doing fine, you know, you can tell them my name, all of that stuff, and, you know, yes, we're doing fine. I would ask them to follow that up with an email just to get it in writing so that you can use their name. So, but again, people guess. You can't stop them from that. I would just, when people ask you directly, well, is it Mary? You know, you can say, you know, I can't tell you that, but I want to reassure you that we are taking the appropriate steps. You know, it's not appropriate for me to tell you that, whatever it is. And I would keep that really close. I mean, even, you know, you can tell if it's the front desk person, you can say, you know, Mary's going to be off in the next couple of weeks. If you have any phone messages, they should be sent to John, whatever. You don't have to tell her Mary was diagnosed positive, or Mary's home because the other person in her office is, or whatever. You know, she does not need to know that. What she needs to know is work-related things. The receptionist may need to know, how do I route the calls, not why is Mary gone. So, and then close the conversation with the employee by just offering additional support, like the EAP. When they go to get tested, the CDC or the Department of Health gives them a lot of resources. They tell them how to clean their home. They ask them questions about people that they've been in contact with. They really do a lot of support for people. But at the same time, if you wanted to provide any resources, again, I put the link for this resource directly on the page. There's a really great fact sheet that you can go to and share that with them. You can also use it to post to share with your other employees. The next couple of slides are the workforce communication. And this is the one that you'll want to, I'll click it so you can start reading it. The one that you'll want to share with the rest of the workforce. Now, those who have been in close contact, you'll have sent home. The rest of them, you'll want to let them know what's going on with that. And again, you want to have it be a letter. You want to have it a warm tone, but you also need, there is some information that you do need to share in this. So I have typed this out or left the text in here. You'll want to tailor that to your own organization, but I just kind of put it in as a sample. I didn't write it. I found it from somebody, the sources are in the back, but I thought it was a pretty good letter. So the first part is, again, health and safety of employees are top priority. This is what we've learned. So we've sent them home. We've sent home anybody else who had close contact. For the rest of you, you know, you didn't have close contact. So for that, you know, here's what the CDC says about close contact, which again changes from day to day. But the rest of them, you're probably a medium risk. However, if you have symptoms, you should inform human resources or contact your healthcare provider, let your boss know, whatever all that is, remind them that it's all confidential and you won't disclose it. So you don't want to encourage them. You know, one of the things that's coming out of the Smithfield thing was they had encouraged people to come to work and given them bonuses for coming to work. And one of the recommendations that came out today was that you should not if people go home sick, you don't want to discourage them from going home sick by taking away maybe a perfect attendance bonus or something like that. So you want to be careful about that because you do actually want to encourage them to go home if they're sick. if they're sick, not if they're well. If you end up deciding that you're going to close and disinfect the organization, so this is just some information, some words you could use about that. So we're going to close it here. We're sending all the people home so we can disinfect. You know, just some information about that and when they can return to work. If you do end up closing the facility for cleaning or for a period of time or whatever, you want to address how those employees that are unable to work but that are not sick, what they'll do for compensation. So if they're able to work there, you're going to pay them because they're working. But maybe if they're not able to work, you don't want to penalize them for it. So, you know, the people who are working don't get extra pay, but those who are not working also won't be penalized. So maybe you'll pay them for some time. Again, that's all up to you how you address that in your organization, but I wanted to put that in so it gives you something to think about. And then reassure that when they come back to work, you're going to make sure that things are clean. You're going to be doing extra cleaning. You're going to be taking care of them and making them feel safe. Because that is the main thing, is that is part of your responsibility, is to keep your employees safe when they're at work. And then just a closing, again, give them some resources, reiterate that you are committed to their health and safety, and tell them if they have any questions of who they should see. So that's just a sample. Like I said, I know there's a lot of information on that. I will include that in the slides that you get when I send out the recording. So the next steps after that, so the employee is home, you've done all your communication, what should you be doing next? And really what it is just to kind of prevent the spread and prepare your workplace so that you don't have ongoing spread. And really, a lot of this stuff is things that you're already doing. OSHA has a great guide on preparing your workplace for a pandemic, and make sure that you're clean and that you're keeping your employees safe. So check the hazards, similar to what you would do if somebody gets hurt on the job. You would go back and kind of do a, an investigation about what happened. What was there, if they slipped and fell, was it because there was a rug? Well, the same thing. You want to go back and say, do we have the hand sanitizers out? Are we using the face masks? Do we have physical barriers in place? Are we cleaning appropriately? Do we have enough staff doing teleworking? Are we making our lunchrooms far enough apart, taking out some of the tables so they aren't close together? Are we preparing by cross-training so that if somebody else is sick, then somebody else, that somebody can do it? You don't want the only person, if you only have one person that knows how to do payroll and they're out for 2 weeks, that can cause ripple effects throughout your entire organization. So make sure people are cross-trained on what to do. Or if you only have one person who can put money in the bank and that person is gone, well, that's not a good. You get checks and you want to make sure more people can get the checks to the bank or whatever it is. Some things that you might want to consider is when employees come back to work, the CDC has said, or the CDC has said that it's okay for us to do screening questions and keep a daily screening log. And the EEOC has agreed that yes, in this situation, it is okay to do that. So again, I put the link directly on this page, but this comes from the Department of Health, South Dakota's Department of Health, with a screening log that you can pull up. And again, make sure the information is kept confidential, but that might be something you want to start doing. Also, think about how you can keep employees separate from each other, encourage them to stay home, and use your leadership. So they're going to watch what you do. If you're wearing face masks at work, then they're going to wear face masks at work. You can put out a thing that basically gives people permission, and more than permission, but you can even mandate that they need to wear face masks at work. I know. Face mask is one of those things that says, well, don't bother wearing face masks because they don't do any good, but always wear a face mask. You should always wear a face mask, but it doesn't really matter because they don't do any good. I know, it's one of those kinds of things, but at the same time, that is the current recommendation, that we wear face masks. So, and my husband's company, they're doing them. They're all just wearing whatever kinds of face masks. People are making them and bringing them in. Other people are doing ones that they've gotten. You can make them for free. On the CDC, there's actually instructions on 3 different types of face masks you can make, including one that you make from a bandana and a couple of rubber bands, no sewing involved. So there's lots of resources out there for people. What I did was just compile some of the sources that I used for this particular webinar. as well as just some other resources that you might have. Again, there's just a lot of stuff out there, but this was stuff that I found particularly informative that you might want to check out. So that's as much as I have today. I want to just say thank you all for coming. We are all here. I'm one person, but I'm part of a much larger team. We do not only help on this, but we help companies every day with whatever employee issues that we have, whether it's hiring or mental health issues that may affect the workplace, manager coaching, benefits administration. I mean, we really do whatever an HR department would do for you. We'll help you out at whatever size organization you are. And I'm going to turn it over to Dan. So thank you all very much. Maybe let's turn over to Dan. Dan, if you're still there, you can jump in when you can. Otherwise, I'm just going to keep on talking for a little bit longer. We have started with, again, things that we have talked about doing for a long time and just didn't quite get it done was, oh, sorry, I need to unmute you. Okay. I don't know where you are. I'll unmute you. All right, Dan, you're live.
All right, I think I'm here. Thank you, folks, for attending our webinar. This is some, at least we felt it's some great information to help us be prepared for our clients when they do have something coming up like this. And for those that we've talked to, it's given them a great deal of reassurance that, okay, at least I know how to proceed. So just a couple words about Alternative HRD. Many of you are familiar with our company. We work with lots of large employers, but the majority of our clients are smaller employers who have no human resource professional on staff. So our goal is to be their HR department, or at least to provide support and guidance when they need that. I do want to make mention of our HR subscription service that some of you may want to consider for your organization. We designed this primarily for very small employers who don't need a significant amount of ongoing or regular HR support, but who are serious about staying up to date and keeping informed. You can read the bullet points on what it includes, but there are a couple things we think are especially valuable right now. One is that if you subscribe for this, you get our leave request form that can be used for emergency paid sick leave for expanded FMLA, that not only helps you approve and consider, but maintain the documentation for that. The other thing we have is a leave tracking form to help you track and monitor and document any leave taken related to the COVID-19. So it's something for you to consider. But if it's something you're interested in, you can email, there's an email there to either Karen's email or info@Alternative HRD. The very last slide has Karen's contact information. And so if you have questions, please don't hesitate to reach out. I've conveniently put Karen's email on there and not mine, but we will work together and answer any questions that you have. So thank you again for your time today. Thank you, Karen, for providing this information. We'll talk to you next time. Thanks.